Diuretics, often known as water pills, are medications that assist your kidneys in excreting increased amounts of salt and water via your urine. Diuretics work by removing surplus fluid from the body, which in turn brings the patient's blood pressure down. Diuretics are helpful in cases when there is an accumulation of too much fluid in the body due to heart failure or other medical conditions. This video will discuss about diuretics. To begin, let us define a diuretic. But first, subscribe to our YouTube channel and hit the bell icon for more videos. Diuretics are drugs that help the body eliminate extra salt and fluid via increased urination. Diuretics are often known as water pills. Because they cause you to urinate more regularly, you should try to take them first thing in the morning if at all possible. It is possible that you may need to take diuretics at the same time each day, perhaps once or twice each day. Thiazide diuretics, such as hydrochlorothiazide, Microzide or Oretic, as well as chlorthalidone, are examples of the many types of diuretics, Hygroton or Thalitone. What they do is assist your kidneys in excreting salt and water from your body, while at the same time preventing you from losing an excessive amount of potassium in the process. Some of the potential adverse effects include bloating, nausea, and headaches. A combination of two different kinds of medication in a single tablet, such as triamterene and hydrochlorothiazide, Thiazide or Microzide. What they do: they cause your kidneys to excrete salt and excess water while preventing you from losing an excessive amount of potassium. Some of the potential adverse effects include headaches and an increased need to urinate. Diuretics are often taken by mouth in the form of diuretic tablets. But, if you are hospitalized, your healthcare professional may provide certain diuretics to you via N4 in your arm. The vast majority of persons who take diuretics do not have any severe side effects as a result of doing so. How exactly do diuretics function? When you take diuretics, your kidneys are stimulated to excrete the excess salt and water that have accumulated in your body along with the urine, pee. Who could possibly require diuretics? Diuretics are necessary for patients who suffer from high blood pressure or have an excessive accumulation of fluid in their bodies. Why do providers prescribe diuretics? The mechanism by which diuretics bring about a reduction in blood pressure is by causing the blood capillaries in your body to become more relaxed and expand. In addition to this, the amount of fluid that has to be pushed around in your blood is decreased, which results in less work for your heart to do. Diuretics are another kind of drug that has the potential to help your body get rid of extra fluid. What conditions are treated with diuretics? Diabetic insipidus, excessive blood pressure, heart failure, cardiomyopathy, pulmonary edema, ascites, renal failure, and nephrotic syndrome are some of the disorders that may benefit from the usage of diuretic drugs. The pressure inside of the eye as well as the pressure inside of the skull were much higher than normal. If you find this video informative, please make sure to subscribe to our channel. How widespread are the use of diuretics? The use of diuretics is quite prevalent. In the top 15 of a ranking of the most often prescribed pharmaceuticals in the United States, 2 diuretic drugs can be found. What are the benefits associated with the use of diuretics? It has been shown that the use of diuretics is useful in the treatment of high blood pressure in a variety of people, including senior adults. These patients were treated with diuretics. In addition, the vast majority of people who use diuretics claim that they have not experienced any unfavorable side effects. What are the potential side effects or dangers of using diuretics? One of the most common unwanted effects of diuretics is an increase in the number of times and the amount that one urinates. This medicine has been associated to a variety of side effects, including but not limited to dizziness, lethargy, migraines, gout, and difficulties achieving an erection. Muscle cramps, a deficiency in potassium, unless you are taking a diuretic that is intended to maintain potassium, and an increase in blood pressure. Unease, together with a racing pulse. Patients who have diabetes often have higher levels of blood sugar, in addition to being dehydrated and having an electrolyte imbalance. When you are taking diuretic pills, your doctor will want to check both the health of your kidneys and the amount of potassium in your blood to ensure that they are operating normally and that your potassium level is within the usual range. If you are pregnant, breastfeeding, an older adult, or if you have difficulties with your kidneys or liver, you should discuss the possible risks of taking diuretics with your primary care physician or another qualified medical professional. What you can do: talk to your healthcare provider if any of the negative effects that you experience while taking diuretics continue to worry you. They can recommend a different medicine or a combination of medications for you to take in order to lessen the negative effects of the treatment. Inform your physician if you suffer from diabetes, renal disease, liver disease, or gout before requesting a prescription for a diuretic. Always be sure you follow the instructions on the label. If you are only supposed to take one dosage per day, you should take it in the morning, either together with your meal or immediately after. If you take more than one dosage per day, the final one should be taken no later than 4 in the afternoon. The kind of diuretic that your doctor prescribes, as well as the nature of your ailment, will determine how many doses you should take each day, how much time should pass between doses, and how long you should continue to take the medication. Record your weight and be sure you weigh yourself at the same time and on the same scale every single day. If you gain 3 pounds in one day or 5 pounds in 1 week, you should make an appointment with your primary care physician. During the time that you are taking them, you should have your blood pressure and kidney function checked on a frequent basis. Potassium and magnesium levels in the blood may be affected by the use of diuretics. It is important that you keep all of your doctor and lab visits so that your body's reaction to this medication may be monitored. Do not discontinue taking your diuretic without first seeing your physician, regardless of whether or not you are experiencing any negative effects from it. That is all for today. Like this video if you find it useful and click on the subscribe button if you want to hear more from us. See you in the next video.